Did you see my video, Bones, Diet, and Iridology? If you haven't, I invite you to hop on over and take a look at it. It's here on YouTube. It's only 9.5 minutes long, and it's a great foundation for the things that we are going to be talking about today. We already know that osteoporosis is the most prevalent metabolic bone disorder there is. We also know there are no tests that predict a person's risk of developing osteoporosis. It can only be diagnosed once the bone loss has started to happen. And that diagnosis is done through a DEXA scan, and you see what a DEXA scan report looks like on your screen here, or an x-ray. The biggest challenge with DEXA scans and x-rays is that they only show bone loss. They don't show how brittle the bones have become as well. Weak bones and brittle bones are slightly different from one another. We need our bones to maintain some elasticity. Our bones need to be able to bend just a little before they break. It does no good to build density if we're not also enhancing elasticity to a certain point. After all, chalk is both dense and brittle. That doesn't paint a pretty picture for what dense and brittle bones might look like, does it? Your client's eyes just might be able to give you some hints as to whether your client is at an increased risk for bone density issues or joint problems. Where the bones and joints are concerned, what we see in the eyes is genetic potential. Let's take a look. As we do this, remember that we never use iridology or sclerology to diagnose, that is, name a disease, or prescribe, that is, name a cure. We use iridology and sclerology as assessment tools. They guide us in the questions we want to ask our clients, and the answers to those questions combined with what we see in our clients' eyes help us to determine what suggestions we would like to make. At times, we may see things and hear answers that tell us that we need to refer our client out for medical care. Here's our first marker. It's called osseous netting. In an eye, the fibers typically start at the outer edge of the iris, come towards the collarette, do a hairpin turn, and then go back out to the edge of the iris. With osseous netting, what we are seeing is fibers that are running across the grain. Now, this is a very fine marking, and you might not be able to see it with handheld equipment. You need serious magnification to see this sign in an iris. The iris is divided into 7 concentric zones. The first 2 zones are typically within the nutritive zone, so inside the collarette. The remaining 5 are outside. So we start counting from the middle: 1, 2, 3, 4, 5, 6, 7. Zone 5 is known as the osseous zone. Now, osseous netting can sit in zone 5, 6, and 7. Depending on where we see the osseous netting, it can give us some clues as to which bones and joints in the body may be more at risk. Osseous netting in and of itself usually speaks of arthritis, so more along the lines of a joint kind of a problem. However, when we combine it with a couple of other markers that we're going to look at today, we can reasonably then extrapolate that osteoporosis or other bone issues may also be a potential for our client. The next marker we are going to look at is called the stomach ring. The stomach ring hugs the pupil, and it typically will be a color slightly different from the rest of the iris. It could be white or pink or mauve or brown or gray. Lots of different color possibilities for the stomach ring. The stomach ring suggests an inefficiency in how the body digests things at the stomach level. Now, the stomach's primary focus is digesting protein. It is supposed to initialize protein digestion. It doesn't do anything with carbs. It doesn't do anything with fats. So when we see a stomach ring, and you won't see a stomach ring in every eye, that's for sure, you can begin to ask questions about protein digestion. A study published in 2011 in the International Journal of Vitamin and Nutrition Research suggested that people who have a higher protein intake, up to 2 grams of protein for each kilogram of body weight on a daily basis, typically have stronger bones. So we want to make sure that our clients are getting enough protein, but getting the protein alone isn't going to guarantee stronger bones. We have to make sure they are digesting it. When we see the stomach ring, our suspicion is that they don't digest protein very well at all. Most of your clients won't even know if they're having a problem digesting protein, and you're going to need to teach them the key indicator for this. The key indicator is gas. Now, we all pass gas. It's just what humans do. Humans and cows, right? We all pass gas. The question is, what does the gas smell like? If the gas is absolutely putrid, or as I will say, eye-watering and room-clearing, that's a problem digesting proteins. That's a client who probably needs more hydrochloric acid to activate their pepsinogen and turn it into pepsin so they can prepare the proteins at the stomach level to move on to be finished in the small intestines. We may be able to enhance bone density and elasticity by ensuring enough protein intake, by ensuring calcium and trace mineral intake, and by supporting the body's ability to use the protein fully and to absorb and assimilate the protein amino acids and the minerals. Our third marker is called comb teeth. Under extreme magnification, we can see how the edge of this iris looks like somebody took little scissors and snipped little slits into the edge of the iris. This is comb teeth. This correlates to how resilient the stomach wall is. Now, when we see lots of comb teeth, it means the stomach wall is lower in resilience than we'd like it to be. Remember that your stomach wall is actually a muscle that has villi protruding into it. And at the base of these villi, we have cells that secrete mucus that coat the villi. And at the top of the villi are the cells that secrete the pepsinogen. The hydrochloric acid is required to activate the pepsinogen and turn it into pepsin. If this stomach wall is weak, we may not have the mucus secretion that we need, we may not have the hydrochloric acid secretion, we may not have the pepsinogen secretion. So we need to do what we can to strengthen that stomach wall and ensure that it can do its job fully. Not only are nutritional choices critical when we're talking about bone density and bone elasticity, but so is digestion, so is absorption and assimilation of everything from protein to calcium to many other macro and micro minerals. The nutrients must be properly prepared by thorough chewing. The stomach must be able to further digest the protein, preparing the protein to be finished off in the small intestines. If the stomach is unable to secrete enough hydrochloric acid to activate the pepsin, the protein digestion cannot continue properly in the small intestines. Hence, we look for the presence of the bone indicator osseous netting and digestive markers like the stomach ring and comb teeth when we are concerned about osteoporosis risks. The 3 markers we've looked at are just a few of the indicators that might suggest that our client is at a greater risk for bone issues.